In this video, I'm going to briefly mention some of the investigations you might consider, and I say briefly because most of the time you don't need any investigations when you're treating a simple case of gastroenteritis with only, say, mild dehydration. So what are the key points here? Let's talk about bloods first. These are usually not necessary. Most countries' guidelines say that you don't need to do bloods when a child has gastroenteritis. The NICE guidelines in the UK, for example, say basically never do bloods unless the child has severe dehydration and you're going to site an IV line. And if you're going to put a cannula in, then send bloods and send the bloods to the lab and get the results back. But otherwise, no need. Next thing is you do need to check glucose though, and this is because hypoglycaemia is not that uncommon in children with gastroenteritis and can be one of the markers of a more unwell child, so worth checking the blood sugar level. Antibiotics, in terms of our first treatment, is not usually necessary. They're just usually not indicated because most cases are viral and even the bacterial ones are often managed supportively only. The mainstay of treatment is going to be rehydration, and I'll come on to that in the next video, which is going to be all about hydration and rehydration. The final thing to say is that when you're treating a child with gastroenteritis, a lot of them will be discharged because they're usually well, they're usually mildly dehydrated only, and they can go home, but you need to have a good safety net in place. So explain when the parents need to bring the child back and possibly arrange a follow-up in a children's review service or, at the GP. The next video we'll be talking about is rehydration, how to do it, why to do it, and, what fluids you can use.